Let's meet Louis, Sharon, and Bram. Louis has been an alcoholic for 12 years. He's recently developed low back pain and has been diagnosed with spinal arthritis. Sharon took antibiotics for strep throat 3 years ago. She was recently diagnosed with asthma. Bram had radiation for pancreatic cancer 6 years back. She's now developed eczema on her elbows and her knees. Intestinal hyperpermeability is a pathological increase in gut permeability. It allows for the absorption of endotoxins, antigens, inflammatory mediators, and in some cases intact bacteria. These agents can cause both local and systemic reactions, associated with a wide range of acute and chronic diseases. Let's go back to Sharon, Louis, and Bram. When Sharon took broad-spectrum antibiotics for the case of strep throat, the antibiotics disturbed the delicate balance of her gut flora, which allowed the passage of pathogens and toxic material into her systemic circulation, eliciting a state of inflammation. This chronic systemic inflammation may be a large contributing factor to the development of her recent onset of asthma. So what would be the best thing to recommend for Sharon? That would be probiotics. Probiotic strains of lactobacillus and bifidobacteria have been clinically shown to reduce inflammation both within the gut and systemically. Studies have demonstrated that it effectively increases the production of anti-inflammatory cytokines while reducing the production of pro-inflammatory cytokines, and it also enhances IgA production within the gut. There's also research to say that probiotics are effective at reducing symptoms of atopic dermatitis because they modulate the level of permeability within the gut. Another RCT double-blinded study showed that lactobacillus were shown to prevent atopic inflammatory disease in children at high risk of eczema and asthma. Let's move on to Louis. Like Sharon, Louis the alcoholic also has a hyperpermeable gut that's leading to global inflammation. Alcohol damages enzymes in the gut needed to determine which nutrients can and cannot pass from the gut to the bloodstream. Alcohol also releases inflammatory markers leading to globalized inflammation, which is contributing to the development of inflammatory arthritis and ankylosing spondylitis. There are several things we can recommend for Louis. Glutamine is considered one of the most important nutrients for healing leaky gut syndrome because it is preferred fuel for healthy functioning enterocytes. Low levels of serum glutamine have been correlated with intestinal barrier disruption, inflammation, and diarrhea in children. One review showed that glutamine reduced hyperpermeability in the gut and decreased serum endotoxins, fever, white blood cells, and heart rate in patients. Because research on glutamine supplementation for gut health is dosed at 30 grams per day, it is critical to decide whether or not the dose this high is appropriate for your patients. Deficiency in zinc in humans have been associated with intestinal wall damage and increase in the ability of inflammatory cells to migrate against the gut barrier and induce a state of systemic inflammation. In one study of patients with Crohn's disease, a daily supplement of 75 milligrams of zinc showed a significant reduction in intestinal permeability. It's important to note that this dose can cause nausea and increase BPH and prostate cancer risk in your male patients. While quercetin has been shown to enhance epithelial barrier function and optimize intestinal permeability, all studies considering the impact of quercetin on intestinal health have been performed on either in vitro or rats. We therefore cannot suggest quercetin as an appropriate treatment recommendation for those with leaky gut syndrome. Let's move over to Bram. While radiation was effective at eliminating Bram's cancer, it damaged mucosal cells and caused local inflammation within her gut. So what can we recommend for Bram? Omega-3 fatty acids have been shown to support the integrity of tight junctions along the intestinal wall as well as reduce inflammation by modulating cytokines. Research has shown that fish oil supplementation in patients with inflammatory bowel disease and rheumatoid arthritis, two conditions associated with intestinal hyperpermeability, reduce inflammation, pain, and NSAID use while improve physical performance. Research has shown that 2.7 grams of fish oil in a ratio of 2 EPA to 1 DHA is an effective dose. As a final remark, we'd like to say that leaky gut syndrome is not a disease itself but merely a stage in the manifestation of other diseases. If the gut is not repaired, systemic disease like autoimmune conditions, psoriasis, eczema, allergies, migraines, depression, and asthma can ensue. Because a leaky gut can develop from various factors, it is critical to identify the cause of the patient's leaky gut in order to understand the mechanism of the damage. This will predict the treatment option most fitting. In summary, the most effective nutritional supplements for a leaky gut are a combination of probiotics, 2.7 grams of fish oil at a ratio of 2 to 1 EPA-DHA, glutamine dose up to 30 grams per day, and zinc dose up to 75 milligrams per day.